Welcome to the ICU podcast, where we explore the vestibular experience through conversations between patients and the health professionals who care for them.
During this podcast, we invite patients to share their stories and healthcare professionals to ask questions so they are equipped to better care for and truly see the invisible challenges faced by their patients. I'm Kimberly Warner.
And I'm Cynthia Ryan, and we are your hosts on this journey of discovery.
Welcome, everyone, to the ICU podcast. I'm really looking forward to this conversation today. I feel like it's just a gathering of old friends. So this month, we are going to talk about mothering and dizziness. And as we all know, caring for oneself with a vestibular disorder is not easy. Add infants, children, and teenagers into the mix, and the spectrum of experience can span from feeling downright impossible to uniquely rewarding. In honor of Mother's Day this month and our community of mothers with vestibular disorders, let's dive into this multi-layered experience of mothering dizzy. We'll discuss considerations in family planning, pregnancy and vestibular disorders, managing self-care, and how to include family in your vestibular experiences so you feel more supported and less overwhelmed and alone. With that, Cynthia, do you want to introduce our first guest?
I do. I am so excited to have both Marissa and Kayla on today. As you said, Kimberly, Marissa, and Kayla have been volunteers with VeDA for a long time, and it's exciting to watch them and listen to their evolution as mothers. So I'll start with Marissa. Marissa is a mother to a 15-year-old son and has been a vestibular patient for over 12 of those years. She lives with vestibular migraine, chronic migraine, and PPPD. When she first developed symptoms, she was a preschool teacher with a 3-year-old at home. Like so many patients, she saw multiple physicians who either thought she was anxious or wanted to try hefty meds that would leave her unable to function. And then in 2014, she experienced a remission of her symptoms and went back to what we call a quote unquote normal life for 4 years. But in 2018, her symptoms returned with a vengeance and she became housebound. Eventually, under the care of Dr. Shin Beh, which many of you know as the king of vestibular migraine, she was able to slowly resume her life. Marissa joined VeDA as an ambassador and started an online support group with fellow vestie Joy Holten. Joy and Marissa have a podcast called Finding Joy in Your Vestibular Journey. And recently, Marissa became a health and wellness coach, so she can share what she's learned with others. Welcome, Marissa.
Thank you. Happy to be here.
And I'm going to introduce our other guest, Kayla McCain. Welcome, Kayla. We're so happy to have you here. Kayla began experiencing symptoms of vestibular neuritis and vestibular migraine in October of 2016. Like many vestibular patients, Kayla fell into despair during the early stages of her diagnosis. However, after getting established with a neurologist, another Dr. Shin Beh patient, and myself as well. So Dr. Beh, if you want to throw some money for this episode. And she got on his treatment plan and was able to adapt to her new normal, became an ambassador with VeDA, and began sharing her experience online at truekaylaisms.com. Kayla left the corporate world shortly after her diagnosis and opened her own business, Kayla McCain Marketing, to be able to continue to pursue her love for content marketing while controlling her work environment with daily dizziness. In 2020, Kayla became a mom, something she wasn't sure was possible with a vestibular disorder. And today she continues to work from home with her 2 young boys, Declan and Grayson, while managing the ups and downs of her vestibular migraine. Wow, this is cool. I just put it together that 3 of us are all being treated by Dr. Beh, which is but I'm not a mother. So I'm going to let you guys take over on this conversation. Let's just start, Kayla, with you, you delayed starting a family because of your vestibular symptoms. Can you describe some of the considerations you had to take and how this was for you, especially emotionally?
Yeah, I was 27 when this all started happening for me, and at that point, I think we'd been married just 2 years, or no, maybe it was into a year and a half, and so we weren't going to start a family like right away, but we were getting to the point where we were really thinking about it. But I, for those first like 6 months, couldn't leave my house. I felt like I was, I was depressed. I was stuck inside. I didn't want to go anywhere, which is very unlike me. I'm an uber extrovert where I want to be out socializing. And so being home and all that was just its own different story. But I had done so much research before I even got to see Dr. Beh about all these different medications and things that were likely to be prescribed. And a lot of them were not something that was compatible with the pregnancy. So I had seen, before I saw Dr. Beh, at least 10 different doctors who wanted to try seizure drugs and other medications for me. But and you'll hear this with a lot of people online, I get these kind of messages all the time on Instagram. I'm scared of trying new drugs. I'm very sensitive to medication. Like, what is your feedback? Well, I was the exact same way. I was very nervous to try anything that I felt like would alter me. I mean, yes, you want to try things that are going to help you so you feel better, but then you don't want anything that's also going to change maybe my personality or change how I'm feeling. And with a lot of those, I know that if you're ready to have a baby, you have to wean off of them. So I was very scared to get on these medications and then start feeling better, get used to whatever the effects were, and then have to start all over again after having a baby. Yeah. So I wanted to make sure that I could get my symptoms managed the way that I wanted to get them managed before even thinking about going down that road of getting pregnant and all of that.
Yeah. I can imagine that was like a scary time because the newness of a baby, I mean, let alone adding a drug into that and the dizziness and all of that. There's so many variables. So and probably no book that you could pick up that just sort of guided you through it.
Right. And I mean, at that point, I was an aunt. I mean, my sister has a few different, she has two that are adopted and 3 of her own children. So I have seen like the different sides of all points of childhood. And I knew that it's not just laying around watching movies with your kids. It's exhausting. You're sleep deprived. There's just a lot that goes into being a mom. So I knew that when that time was going to happen for me, that I needed to be prepared. And that's my personality anyway. Like, even if I didn't have, a vestibular disorder, I'd still would be making sure I prepped. But in this case, you don't know what it's like to be a mom and throw in the wrench of a vestibular disorder. Because I heard a lot from people, you either could get pregnant and your symptoms could go away and it would be amazing, which I prayed for would be for me, or it could be way worse. So there was also that where you're like, okay, I'm finally starting to feel a little bit better. I'm getting this managed. Do I want to do that? Like, where do I need to be at before I start that journey in my life?
Yeah. And that you just even had to think about it. You already have everything on your plate with dealing with a vestibular disorder, figuring out what it is and how to manage it. And on top of that, you have this other stress, this other factor that's limiting your life. That's got to be really frustrating.
Right. And again, I wanted to see if there was a way to naturally get to a point where I was comfortable before having a baby. And that took time. I mean, this happened when I was 27. I didn't get pregnant till we found out the day I turned 30. So it wasn't, it took about 3 years for me to really navigate. And, at that point, we were wanting to have kids soonish after getting married, but we definitely delayed it because of that.
So Kayla, you had to think about whether and how to have kids because you already had a vestibular diagnosis. Marissa, you had a 3-year-old at home when you were first diagnosed. So can you tell us a little bit about when you first began experiencing dizziness and how that correlated with your journey as a mother?
Yeah. So my symptoms started in 2011 and, I was in a stressful work environment. I was working full time. I was able to have my son with me. He was in another preschool classroom, but, it's just like Kayla said, it's stressful. Like when you have your own little one and then you've been working with little ones all day. So, there was just a lot of stress, going on, and I was getting more, migraines, more headaches, pain, like actual pain. And then it was like one day when I was driving, it was like a light switch changed where I all of a sudden didn't have pain. I just had this like overwhelmingly dizzy imbalance, on a boat feeling, rocking, just scary symptoms. So, that's how it started for me. And, you think the worst always first. You think like, oh, it's got to be a brain tumor or something, so that was really hard as having just starting a family and all that. So yeah,
I
that's
can't
kind of
even
how it
I
started.
can't even imagine feeling that way. I remember feeling that way myself, but it's such a different element when you're a mom. I feel like anytime
Yeah.
anything happens now, I'm like, "Oh, but like, what would I do for my kids?" And I can't even imagine
Yeah.
like being on your side of it and getting first diagnosed.
Yeah, and having my first onset driving my car with my son in the back.
Yeah.
Oh my gosh, that's
Super
terrifying.
scary.
Did
So
you tell him what was going on in that moment? Do you remember? Or were you just like trying to make sure he didn't worry or
yeah, I think I was trying to make sure he didn't worry. And yeah, we were just trying to get to my mom's house. So, I don't think at that age, like he really picked up on, luckily too much of it. Like, I mean, he would notice things, but it was just, yeah, very scary moment.
so there's a theme of fear here that whether it's be prenatal fear or even with a little boy, that type of fear, I think really, as we've learned with vestibular disorders, it exacerbates our symptoms too. If maybe we had just like chill, nothing big, and we had a symptom, and then maybe we just sort of ignored it, then it might not have gone into a full-blown vestibular disorder. But with all those stresses stacked, whatever that is in your life, I think it tends to sort of exaggerate the symptoms and maybe even prolong them. Kayla, so you entered into pregnancy then. I kind of want to know, how did your vestibular symptoms affect the pregnancy and vice versa?
Yeah, it's kind of funny. I say it's funny. It's funny, like in hindsight, based on like people I've talked to. But when I got pregnant with my first son, Declan, I became very sick. I was diagnosed with HG. I'm going to make sure I don't butcher the hyperemesis gravidarum, to where I was just puking the entire pregnancy. So I basically switched having, the vestibular symptoms to being very, very sick, which also, caused my body stress. And then in turn, with my natural dizziness symptoms and vestibular symptoms that came with it. And it's crazy because I feel like I dealt with that. And then another thing that happened during my pregnancy was just from the extra blood flow, my tinnitus was increasingly worse just because of how much pressure was in your head. So between those two things, my symptoms definitely, I feel like, were exasperated. And but the crazy thing is like the minute he came out, and I had to have a C-section too because I had other issues that were not vestibular related. The minute he came out, the sickness went away, like the pressure went away, and it was like, oh, okay, like my body can take a break because I'm not having all these other ailments going on. But my issues really started more postpartum than they did pregnancy. I feel like pregnancy was because of another ailment that I had gotten sick with, and then postpartum was just a reaction to hormones, which has been my problem like since the get-go. Now we kind of chatted on off air before about this, but I was very sensitive with birth control. That was one of the first things that I got off of that actually helped me. And I think just with any kind of changes in hormones, my body just really reacts. And after having Declan, I will never forget that they always say sleep when the baby sleeps. And I tried to do that, which I'm like not the personality to sleep all day long. It just stresses me out as it is. But I remember I was taking a nap and I woke up with just this, like the elevator sensation, like I was melting into the couch. And I think I'd been probably 5 days postpartum after having Declan. And I just was filled with that same anxiety, just scared, fear, everything that I felt when I first got sick with my vestibular migraine. And come to find out that's part of like baby blues and when your body's adjusting from hormones. But I would say that was probably one of like the scary moments, and then being like, oh my gosh, is this what this is going to be like now? Is this what my life is like now that I have a baby? Do I have to start all the way back at the beginning?
Yeah.
It was pretty scary.
Yeah.
Oh my gosh. I can feel that even as you talk about it. It's like, oh, you just put me right back into those experiences. So it's so helpless feeling.
Yeah. It's not, I mean, even me talking about it, it was very traumatic. I can like picture myself right in that moment all over again.
Yeah. And talking about fear, you, Kimberly, you had been mentioning that fear seems to be a theme here, a factor. And I remember that during our Life for Balanced Chronicles docuseries, Sandy had been, who also I think has vestibular migraine, had been talking about being afraid to hold her baby because she wasn't sure when an episode would come on, and that's got to be such a push and pull of emotions.
Yeah, it definitely is. And I remember I was just talking to my husband about this the other day, because during that period of time because this was during the pandemic, I had Declan when the world shut down. I had him March 2020. Like it was a really weird time because you could get support from doctors, but it was all from virtual. Like you didn't get, the kind of treatment that a lot of, new moms were used to. It was all just a whole, and you had the other fear too of, the pandemic and everything that was going on. But I remember my bassinet had wheels on it. So if I was scared to hold him, I would put Declan in his bassinet and kind of push it around to where I needed to go, because I at least felt if an episode was going to come, or while I was still trying to manage coming back down to my normal, it was something that I could control. And I felt that he was safe if I was alone, or, if my husband was upstairs or what have you.
Wow.
Yeah, I so can relate to that, Kayla, because that was so much of what I felt having this, my kind of first time go around with it when Ethan was young, being very afraid to be alone with him. That's something, was going to happen to me. Like I would get dizzy and fall down or something. So I had taught him early on, like, how to call dad. And then, even I remember teaching him like 911, like if mommy's not feeling good, this is what we do. And, just trying to be prepared, and even going out somewhere, like I would feel much more comfortable if someone was with me. That was a thing. I never really ventured out. Well, I couldn't drive at the time, but I didn't venture out on my own, like just with him. So the day that I finally could take him on my own, like was just an amazing feeling, because for so long I couldn't, because what Kayla was saying, like you want them to be safe, and you don't know what's going to happen to you. Like if these symptoms come or whatever, you have an attack. So yeah, I totally relate to that.
Yeah, I can't. So sorry, go ahead, Cynthia.
Marissa, I was going to ask you, at what point did Ethan become aware that you were having these symptoms and that it was an issue, that it wasn't normal?
I would say probably like maybe kindergarten or a little before even. He knew, because, I'd say, mommy can't drive, right now, because I get dizzy. And how I explained it to him was, if you run in a circle, or, you're on a merry-go-round, and when you get off, how you feel, that's, what mommy's feeling right now. So, I tried to explain it so he would understand. But it never seemed to, like, I think kids are so resilient and compassionate, and he never really seemed to notice, that like our friends would drive us places, and, I had the support of my family. Like my family would help drive me to work, or my husband would drop us off. So, I mean, I had support, but yeah, it's strange. So yeah, definitely my first go around with it, he didn't notice as much, I think.
I'm just feeling so much admiration for you guys. Honestly, I mean, I know what it's like firsthand to feel so frightened in your own skin, and then to have another being and the newness of all of that, and to try to navigate it and communicate. And it's like, whoa, you guys, I want to give you a gold stars, a crown.
Because you went through pregnancy with it. So yeah.
I mean, like I said, though, I feel like, I recently had another health issue, and I thought to myself, like, how much anxiety it created for me. And it wasn't nearly as similar to like a vestibular disorder. And I kept thinking, I don't know what I would do if this had happened having children already. So, I mean, it's definitely, I think both sides just really have, I mean, I'll never be able to experience that, and, and vice versa, but I can't even imagine how that was for you. Especially having to explain to your child what's happening. And, like, I can't even imagine my son seeing how I was for those first 6 months when I got sick. I don't even know how I would explain that.
Kayla, when you had your toddler, when you were still, I mean, dizzy and navigating all of this, and I'm imagining, like, we hear this term, the spoons. Did you feel like there were times where you just didn't have enough to give? And what was that like for you?
Yeah. And of course, I mean, and being a mother, whether you have a disorder, a vestibular disorder or not, I mean, it drains you. It's exhausting. I mean, your children are your life, and they take a lot from you, but it's also so rewarding. And when you're also dealing with an illness like this, yeah, I mean, there were some days where, if I was feeling just awful from having an attack, or if I still to this day, there's also the mom guilt that comes with it, because I might have to lay around a little bit more, and that might require them even watching more TV than I would like, or having screen time. And it's, it's the guilt of, I'd rather be engaging and doing activities with my children than throwing on the TV, but at the same time, it's also like kind of the balance of taking care of myself too. And I had to get over that, especially when I had my second, because there's days where you just don't have it. Like you said, spoons. I didn't have the energy. When Declan was a baby, I remember I would joke too, because like, they do like tummy time and they're playing on their mats and stuff. And I'm like, this always kind of worked out, because I could just lay next to him and let him do his thing.
Mm-hmm.
But and luckily when they're babies, they nap a lot. But I actually, with my littlest, my son Grayson, after I had him, I was able to really finally get on medication. And that's when I started feeling just so much better, a lot more like myself. I was able to manage postpartum much better, but there are still days, because this isn't, it's not magically gone, where I will just randomly get hit with an attack. And I remember I was putting him down for a nap. My other son was already napping, and I was rocking him, and I'm in the dark, which usually feels great for me because I can't stand the light. And I was rocking him, and I remember going, oh no. I could feel my eyes starting to do kind of the aura, the floating, like the colors. And again, I'm like, I'm in the dark. Like, this is usually not where this happens. And so I immediately was like, I need to put him in his crib. I am nervous holding him. I need to get him in his crib. So I put him down. And as I walked out, I started, because I'm sure everyone's familiar with the Alice in Wonderland symptoms. Mm-hmm. That's something that happens when I get really bad attacks. I could feel my hands starting to stretch out, and the hallway got really long, and I feel like I essentially was crawling to my room. And luckily my mom was off that day, and I was able to call her, and I was like, I need you to come over, because I physically feel like I cannot take care of my kids right now. Mm-hmm. My husband was working. He wasn't able to come home, and my mom was able to rush over, which that's not every day. My mom still works too. It just happened to be on a day that she had off. But I remember I just laid in bed, and she took care of my kids the rest of the afternoon. I had to take my rescue med, because an attack out of the blue, like I was having a great day, nothing like to precursor. I wasn't stressed or anything. And going back to, I know what we kind of talked about, just feeling scared and not being able to take care of my kids in that moment. I was lucky I have, my mom available to help out, but yeah, there are times when it can get to the where you're so depleted, and then the next thing you know, you're having a full-fledged attack. So.
Yeah.
Oh
Yeah.
man.
So Kayla, how old are your children now?
Declan's birthday is in 2 weeks. He'll be 4, and Gray will be 2 in July.
Awesome. Wow.
They're still so young.
I know. It's such a fun stage too, and they're starting to become such buddies. And it's kind of going back to actually what Marissa had said. Declan, I don't know how much he understands, but he definitely understands that mama gets dizzy. And it's funny, he knows it happens after I work out, because I'm always dizzy if I run or if I cycle. And if I come in from the garage or from outside, he'll go, "Mommy, you need to sit down. I know you're dizzy." And it's sweet because I'm like, I don't know what level he understands that, but it's sweet because he knows, because we'll say, if they start buzzing around me, it can be very overwhelming. So he knows to kind of just hang out with me because I'll sit down for 15 minutes to really get my bearings. But it cracks us up now because Declan will just use that in context. He'll go, "Sorry, I can't take a bath. I'm dizzy right now." Like, "Oh, who are you?"
Smart.
He hears his mom too much.
Well, it's kind of like this is the mom he grew up with, and so it's not unusual. It's not weird or maybe even scary for him to see you having symptoms like that. I can tell you, for myself, my mother has vestibular migraine and Meniere's, so I grew up with that as well, and mom having a dizzy attack was just a thing. We all knew that it happened and what to do. Marissa, I'm curious. So, and how old is Ethan now?
He's 15.
So wow. So and that's I remember. I'll just tell you guys an interesting. I was 15 when my mom had one of the biggest vertigo episodes that I remember her having, and it was the middle of the night, and my father was out of town, and my sister and I called 911, and in came I don't know, it seemed like a half a dozen paramedics. I mean, it was like it was this whole thing. But to us, it was I could not put myself in my mom's shoes at that time. Now I can. But at that time, it was this thing that was happening outside of me to my mom. So, Marissa, how do you communicate with Ethan now about what you're going through? And do you think he gets, how scary it is for you to have a vestibular episode?
Yes. So yeah, looking back in 2018, where things came back and were so much worse than the first time. We figured out, he was 10. He was about in 3rd grade. And at this time, he definitely knew, what was going on with me. And I think he would be worried. I try to hide it from him. But he knew I was on the couch a lot, and he knew, if he got off the bus and he saw my mom at the bus stop, he knew, okay, mom's inside, she's probably not feeling good. And thankfully, like Kayla said, I had my mom to help, when she could. But yeah, he definitely understood. He actually, when I did the chronicles and he saw, the video, he was just, cause he knows, he sees it. And, he'd always try to tell me, "Mom, you're okay." He would sit with me. He used to always, especially when he was in 3rd grade or 4th grade, whatever, he'd want to show me a movie on his iPad. And of course I couldn't watch it. So I'd say, I can listen to it. You can play it and I'll just listen, and we'd sit together. But yeah, it was so hard. I missed a lot of, soccer is a big part of Ethan's life. And I missed a lot of that. Even just being present to be able to go to parent-teacher conferences, events at school that I would want to participate in, I wasn't able to. So, now when he sees me And what I've been doing the last 2 years, you know, he'll tell me, he's like, I'm so happy for you, Mom. And, you know, you can just tell, like, he knows that Mom's happy now and doing better.
Yeah.
That's
Yeah.
sweet.
Yeah.
That's
But it
I
was
think
definitely harder when he was older. It was definitely harder just because he knew, you know.
Yeah.
No,
Our
like
families definitely recognize the changes happening in us. And, you know,
Oh,
we're
yeah.
so
Mhm.
focused on what's happening, but it affects them and they're aware of the subtle or the dramatic changes. So let's just talk about self-care a little bit. We mentioned already getting your family to step in and help. But what else, what does self-care look like? Both of you can let's just sort of ping pong around a little bit.
For me, I would say, I mean, exercise is definitely something that helps me. So I definitely, because I'm a mom and I work from home, I mean, it's pretty strapped down with a lot of responsibilities. I have, you know, my own little garage gym, and I also have a running trail behind my house. So I even will get my boys, and this is kind of funny because it actually helps when I'm dizzy too, because like I said, I still push myself to exercise, but I do struggle with dizziness after exercising. And I got a double jogging stroller. So I stick them both in there and it gets them out, but it's also like time for me too, to just take care of myself and find that I can still exercise while being a mom and having, you know, everything else that's on my plate. And then, you know, of course I need my time too. So I try at least once a month to try to get a massage or some kind of self-care thing for myself. That's just, you know, not only helps me just relax mentally, but it also does help with my, you know, my stress levels are high. I'm more likely to going to have an attack. So it just helps in general for me.
I love that.
Yeah.
Yeah.
All those things to keep us in check so we don't have those attacks. Yeah, that's for me. Definitely, you know, I still do some of my vestibular therapy exercises. I do some vision exercises. I also do light therapy. And I consider that all kind of self-care to keep me functioning. Also, you know, I've adjusted my diet. So I watch, you know, the foods I'm eating, to avoid triggers. Also, you know, just sleep is so important. I know as a mom, it's hard, especially when you have the little ones. It does get easier, at least when they get a little older. But just trying to stay on track with that. And I've really gotten into more of some mindfulness and some breathing exercises that has helped me, I'd say. And also exercise. I love to just get out and walk and, you know, be outside in nature. And so, yeah, that's kind of me.
It also sounds like being okay with, like you said, not maybe going to all the soccer games. And, you know, I think as mothers, it sounds like that's, you know, we all want to be perfect in the world and we want to do our very best. And I think maybe self-care as a mother with vestibular disorders means being okay with saying no and communicating that to your children. Does that ring true?
Definitely. Mm-hmm.
I think it's just the struggle with that. And I really felt for you because I feel like from having little kids, you know, my little one wants me to pick him up and spin around with him like his dad and stuff does. And I'm like, yeah, that's not happening. I can't do that. But stuff like that kind of breaks your heart because it makes you, it's a reminder that, you know, you're not the stereotypical like normal mom. You know, you have a vestibular disorder, and I try to just, you know, have mindfulness and be thankful, you know, that I've gotten to a place where I was able to have my children and I can function. But sometimes it feels like those things can be robbed. I mean, it probably you do feel that way that you can't go to the soccer game because of, you know, how you're feeling. And I imagine that being in my future. I mean, we went to Disneyland last year, and there's a lot of things I couldn't participate with my family. It was fun to be there, but it's times like that where you're like, oh, I wish I could be doing like, you know, the teacups with everybody and things like that. But that's not stuff it's just not realistic. Yeah. But it's kind of also finding, I guess, a way to battle knowing that you need to have self-care for yourself and, you know, not going to those things, but then you're also kind of fighting that mom guilt as well. So it's finding like a healthy balance to where, you know, why you're doing these things and trying to combat that guilt that comes with it.
Yeah.
Yeah.
It's definitely a healthy balance. Yeah. I think that's great you took a trip with your family.
Yeah. Well,
Yeah.
I know. That's
Disneyland.
recovery time after those.
Yeah.
How were you after a day at Disneyland? I just have to ask.
Oh man. And it was raining, which also is just, you get the storm and everything going. It was okay. It's again, I feel like I have the type of just mindset where I really don't want to miss out on life. And I've been that way since I got sick and I started just getting to a point where I started feeling more like myself. I just didn't want to miss out on things. So it's whether I'm struggling in the time, I'm still grateful that I did it and that I'm there for the memories. But yeah, I mean, at the time it was nice because I was still nursing my baby and they had a nursing room. So it was like an indoor quiet space. And so I kind of just needed to keep it for myself. I'm like, okay. Like you can just like take a breather. I'm going to hang out here for like an hour, go out with our toddler, So.
Yeah.
You were talking about, not being able to go to soccer games. And it made me wonder if you have to also communicate your limitations to the other mothers, maybe in the groups that you're interacting with. And how is that? Is that challenging to?
That was hard for me. Because I'm sure, Kayla, you can relate, like a lot of people don't understand what we're going through. And they just think that how could this possibly still be going on? Like you should be better in a few days or, and when it's going on for like months and years or whatever. So I really pulled back from a lot of my friend moms, like from soccer and stuff, because it just, I got tired of explaining things and, it was hard, but I was like, I got to do what I got to do,
Exactly.
So, yeah.
I'm not at soccer mom level yet, but my son's in preschool and, there's those various moms that want you to get more involved and I'm already pretty spread thin with everything that I have. And, I feel like this one mom I've interacted with a couple times always catches me on a brain fog day. Like it's a day where I just had a migraine the previous day and I'm kind of coming off of it. I'm very brain foggy. So she'll ask me all these questions like, did you get such and such email? And I'm like, what? I can't even function because my head, I'm still just, it's hard when you have brain fog. And I'm always thinking like, I wonder what these people think of me. Like, she's the mom who always has to have her sunglasses on all the way taking her kid into preschool because I can't, like just, I wonder, but I'm like at the same time, like you just got to do you got to take care of you and your children. And if I'm not going to be adding on more to my plate than I already have.
It makes me wonder, I don't know, Cynthia, you could probably talk to this with, vestibular surveys, but if you were in a group of 10 women and one person has a vestibular disorder, if she brought that up, how many of those other women would have something similar or know someone with that? Is that, even likely that if that was brought up with the mothers, one of them might go, oh yeah, I know someone with that? Or is it more like, nobody's heard of it?
Well, the general statistics are, 1 in 3 adults over 40 will have some sort of vestibular dysfunction in their life. So, it's not atypical, but I don't think it's as typical of people at the mothering age, especially, in your 20s. We're learning that it's there, especially vestibular migraine. I think we see vestibular migraine in a lot of women who are going through hormonal changes, but as everybody knows, the challenge is in getting it diagnosed. And I think that's what you're referring to there, or leading to, is that there may be other women in these groups who maybe have a vestibular problem and don't recognize it as such.
Yeah.
Yeah.
Well, so let's go back to kids. I was just curious about that. I'm wondering too what childcare looks like, because especially it sounds like, Kayla, you might have an episode that is unpredictable, like you've had, and perhaps do you ever have to just quick call childcare and get someone to help out, or how do you navigate that?
I luckily have kind of a unique situation as of right now, which has been great with having little kids, is my husband and I both have been working from home. So he is right there most times if something happens. And, you know, he runs his own business as well. So he's able to, like, you know, step in if I need him to, but, you know, he's our breadwinner. So he's the main worker in the family. So, you know, that's usually if I really need him. But yeah, I've been very thankful to have him, you know, just be so hands-on if I need him. But like that instance that I talked about previously, you know, I think he was out of town for work. And so he does travel. So with times like that, I had to call my mom. My sister is also not too far away either. So like I have family to rely on, which is a little scary because we're relocating. And so we'll see how that goes. I think I'm going to end up looking for like some kind of on-call, like nanny or babysitter situation just for those reasons, because, you know, I need someone my kids are comfortable with and somebody I need, you know, quickly. But yeah.
Wow.
Yeah, I too, Kayla, I had my mom, you know, usually, and if my husband would travel too, and she would come and stay with us, you know, and that just helps so much because, again, it was like that fear if something happens or, you know, so.
It was definitely worse for me between my two because I wasn't on medication. I feel like since having Grayson, that's my littlest, I was able to get on medication, and that's just really, really significantly improved my symptoms, because before I knew I wanted to have a second. So I was still doing the same game plan before the first, where you don't get on medicine that you're going to have to wean off of. And it's kind of just basically gripping on until, you know, your knuckles are turning white and until I was done having the kids. And medications definitely really helped this last time. But I say that, but that's when my horrible attack happened. And I was still on medication. So
Yeah.
Kayla, on that note, looking back, is there anything you would do differently?
I feel like looking back and doing something differently, I did that with my second pregnancy. I learned from the first and I made changes with the second. With the second, I also started having symptoms of HG all over again. So I took the doctor's recommendation and got on medications that were approved during pregnancy. But those medications stopped the throwing up, but started giving me classic migraine symptoms. So I had a lot of headaches and just, you know, your typical migraine. But postpartum, I was ready with a plan. I was not going to wake up feeling like I was melting into the couch again. So I worked with Dr. Beh on a whole, just as soon as this baby is out, this is what we're doing. And that significantly helped. And it's the same thing I pretty much did when I stopped breastfeeding each time too. Because again, hormones were huge factors both times, because my body just reacts very strongly when I'm weaning and, you know, there's hormone changes. So I had plans for both of those the second time, and it made a huge difference.
Wow.
That's good.
We just did an episode on menopause, and same, Kayla. I mean, it's those hormones that get us, these different chapters in our lives. And for some, it actually makes things better. And it's just so unpredictable. It's wild how varied these experiences are for us. So on a positive, let's kind of end on a positive note. Marissa, we'll start with you, but Kayla, chime in. How has having children been actually a really sweet, important experience in your recovery? Have they added anything to that journey for you?
Oh gosh. I mean, yeah, I mean, Kayla, you know, like just being a mom is like the greatest gift. And you know, vestibular or not, you know, I wouldn't change anything. He's just, I think he's seen so much, like, and learned about compassion, and you know, if after seeing what I've gone through, and you know, whenever I was having a really bad time, or you know, I'd have to be having an MRI or testing, I would think of Ethan, and that's all I would think about, and that would help me, you know, get through things, because I just, you know, wanted to be there for him and you know, be with him. So yeah, I mean, we just have this special bond, I think, too, you know, after just him seeing what I've gone through. And yeah, it's wonderful to have to have him.
Yeah.
I mean, I can relate to that in my own way with having little ones. I can't even imagine a sweet 15-year-old. I mean, just watching his mom go through, you know, just, you know, having a bad day. But I feel like my son, Declan Holmes, before, it's cute to see the little caretaker that he's turned into. And I mean, it's sweet because, you know, that's my job, to take care of him. That's what I do all day long. And when I'm not feeling well, it's like he knows. And I feel like, you know, they just watch everything and they just, you know, little sponges and soaking it all in. And, you know, if I'm not feeling well, he'll be like, okay, we should turn off the lights and mommy, here are your glasses. Because he always knows I wear my glasses when I'm not feeling well. And I mean, and like I said before, you know, he knows that if I come in from working out, I need to sit down because I'm dizzy. So it's just sweet to see that, you know, he's also compassionate, as you're explaining about your son. You know, he has this empathy for me and sympathy for me for like what I'm going through. And yeah, it's just, you don't think about it. I didn't think about that part of it when I had my kids. You know, to me, it was I'd be taking care of them and, you know, they're my whole world. But the fact that, you know, it just shows how much they love their mom back and wanting to help me too. It's just, I wouldn't change it for the world. I'd do it all over again.
It would be really interesting to see if, you know, being a caretaker so early influences his life decisions and his career choices.
And his relationships.
Yeah.
Absolutely. Well, I just want to, first of all, I think that there are a lot of mothers and mothers-to-be out there who have learned so much during this time that we've been talking. And I also want to give a big shout out to all the mothers out there who struggle with vestibular symptoms, and just recognize, you know, how we know that it is a challenge, and you're just real heroes for doing this and for doing it for love. So happy Mother's Day to you all.
Yeah. Happy Mother's Day. Thank you, Marissa. Thank you, Kayla.
Thank you.
Thank you.
Thanks for tuning in to ICU this month.
We hope this conversation sparked new understanding of the vestibular journey. And for all of our patients out there, leaves you feeling just a little more heard and a little more seen. I see you.